Good evening, everybody, and a very warm personal welcome. I recognize some familiar faces and congratulate you for attending, because that speaks to the fact that you are choosing to play an active role in your rehabilitation, that you are choosing to become a driving force in your road to recovery, and I believe that that will serve you well. The anatomical parts that make up the passageways in the head and neck are wondrously designed. They're very complex and intricate, and they are absolutely fascinating. What happens there, both with individual activity and the combined activities, are things that we use in our everyday life without even knowing it. And they are what make us human, and we tend to take them for granted. So, we may know a little bit about the tongue and marvel at its dexterity and think about and sort of at some level be aware that we can produce these very fine shaping differences that allow us to make the difference between us and it both produced in the same place. But for the most part, this is something, again, we take for granted. And the tongue is pretty miraculous. It's like the elephant's trunk. It's a hydrostat. It's the only muscle system in the body that has one point of attachment. Another part of our head and neck anatomy that we might use all the time, never really think about, is the very miraculous vocal cords, which can vibrate hundreds of times a second. And, we see them at their best in opera singers. But, this is a remarkable instrument, but we don't ever think about it. Still, other parts of our anatomy, like the throat or the pharynx, are sort of less well known. They're almost silent, and we don't really notice them until we get into trouble. So the throat is really a highly sensitive, responsive, flexible, muscular tube. And it is an absolutely key player in the swallowing process. But we wouldn't really know that. We don't think much about our throats. Either way, when these structures in these passageways change, there is a very good chance that there will be a disruption in function. So structure and function, they go together. And just like in Salvador Dali's painting, where you can see both a dog and a fruit bowl, if you look at it carefully, both things are there at the same time. See that? Structure and function are those two sides of the same coin. They go together. Anyway, when there are changes to function, it is more than just an interruption of moving parts. Suddenly, we face a whole lot of functional challenges, and these will impact on everyday life. So if you are struggling with some of these challenges, your sense of loss is real, and it needs to be acknowledged. And that's a very healthy starting point for beginning the rehabilitation journey. And until the time that one faces a cancer experience like this, we live in this rich gastronomic world where everything is a matter of choice. You can go spicy, you can go juicy and stringy and crunchy at the same time, or you can taste something, you can enjoy something that's completely rare if you want. We tend to function a bit like in this children's book called Cloudy with a Chance of Meatballs, where we can eat everything that's around us. And in this book, nobody cooks, but the food just comes down from the sky. And if it's hamburgers, everybody eats hamburgers and there's no problem. Until we have a cancer experience, there's a very good chance that if everybody's having pizza round the table, we can all have pizza. But we can suddenly be stopped in our tracks. In the same way, we have conversations with friends, we meet for a cuppa, go for a coffee, grab a quick bite, or sit around in company and enjoy a meal. We walk through a flower market and just enjoy the freshness of the flowers. We smell it, enjoy it. We can detect the smell of smoke in an instant, and these are things we've never had to think about. But suddenly, when these things change, so for example, suddenly the tongue doesn't move so well, or the mouth is constantly feeling parched, or part of the tongue is reconstituted, or the airway is reconfigured, we suddenly become aware of a whole lot of things that are happening in the background. For example, saliva. We produce about 1 liter of saliva every day, which we clear without thinking by just swallowing once a minute. And for anybody who's had surgery, they will tell you suddenly, I don't know why I'm producing so much saliva, but the fact is that the swallowing isn't just happening so automatically. And if one's saliva changes with radiation treatment, the makeup will make things taste different. Suddenly, eating is just so much more of a chore where it takes longer to chew, it takes longer to gather up the food in your mouth in order to swallow it, and eating just seems to take forever. If one has had a total laryngectomy or total removal of the voice box, which is a little more radical, and you've got complete separation of the food passageway in red and the airway in front in blue, and it's now permanently relying on an open, and we're now permanently breathing through an opening in the neck, there is quite a lot of adjustment. We have to begin to speak very deliberately by initially using a finger to close off that opening in the neck, redirect air through a voice prosthesis which links the food and air passageways, and make the muscles of the throat vibrate. So that becomes a very deliberate thing for something we took completely for granted. In the same way, the function of the nose needs to be replaced by attaching a filter or heat moisture exchanger to the neck to filter, warm, humidify the air. And when that isn't done, or when some sort of filtering is not used, we suddenly become aware that there's almost half a cup of mucus that's produced all the time, which is normally handled by these fine hairs in the respiratory tract. And that happens when the temperature of the air is of optimal humidity and temperature, but when that changes and one's breathing directly into the neck, things become much more complicated. There's much more mucus, and there's a call for a lot of adjustment. So, as speech language pathologists in the center, we see patients with tumors in all of these sites. And the head and neck group is probably less than 10% of all the patients that come to this building, but they take up more than 90% of our time. The demands for rehabilitation are really substantial. And it's been well known for the past 30 years, very well stated here by an interdisciplinary group, that few other cancers need that amount of preparation and rehabilitation that the head and neck cancer patient group needs. And so recently, head and neck cancer, which is relatively uncommon, has had a little more press with all the talk about the human papillomavirus and its role in the head and neck, with the spotlight on celebrities like Roger Ebert, the film critic, and Michael Douglas, the actor, who recently came as a sort of poster child and spoke to one of our international head and neck conferences. But probably until one experiences head and neck cancer, one may not know anybody at all who's walked that road. And so there's just been an increase in awareness. Certainly head and neck cancers raise some very complex problems because they occur at a very busy intersection, at a very at a place where, at a shared space where there are lots of overlapping functions which have a complex nerve supply. So here are the ones that can be directly affected, either alone or in combination: swallowing, chewing, talking, sense of smell, coughing, and each of them is complex. I mean, to do a single swallow, which should happen in less than 2 seconds, takes at least 26 pairs of muscles. Some of these functions occur, they're almost timeshare. They should not happen at the same time. We should not be swallowing and breathing at the same time because we would choke. So there is exquisite coordination that goes on. But this may all be affected with treatment, with a tumor or treatment. At the same time, these are small structures, so very slight differences in the location of a tumor can make for very different functional challenges and different treatment packages. So I would imagine that in this room, for all the people who are here, there's a lot of variety in the challenges that people face. So this is not, the functional challenges are not the same for everybody. And the other thing, what makes this group so unique, and this is stated very eloquently by by a physician who had a laryngectomy. He said, "We bear our cancer to the world with a head and neck cancer, because we have to speak, and different sounding speech can be heard. Sometimes there is swelling or asymmetry. We can look different. So it's evident. It's not like the breast or the prostate or the lung, where these things are hidden under clothing and nobody needs to know about it. It tends to be more publicly evident, and so that requires adjustment. And depending on who you are and what's going on in your life, the experience can be very different. If you are a teacher or a lawyer or an actor and you're unable to speak, it's very different to if you're an accountant or if you're a retired plumber. The demands are very different on your life, on your life, on your ability to function. At the same time, the functional outcomes are very complex because to a large extent they depend on age and general health, other factors that are going on in one's health, social and family involvement, and the kind of access one has to rehabilitation. For example, how far away you live and how easy it is to get here. So again, I think this is a very important statement. When it comes to head and neck cancer, ask not what disease the person has, but rather what person the disease has. And I see that as very empowering because one can get oneself into the mindset of saying, I'm going to be the kind of person that is going to work my way through that. So what else is going on in this field called cancer rehabilitation that is in your favor as a head and neck patient? Well, it is the fastest growing area in rehabilitation medicine. Basically, the goal is to restore skills, to deal with any associated physical, psychological, occupational issues, and ultimately to recover those skills and be able to return to a decent quality of life. And what's happening in the field in general from the medical standpoint is that survival rates are slowly improving. We've got combinations of therapy that help to do that. There are lots of technical and technological advancements. We've got robots, we've got microvascular techniques operating through a microscope. We've got radiotherapy beams that are able to focus very specifically on certain tissues while trying to spare the tissues right next to them, etc., etc. And there is a real emphasis not just on surviving and getting rid of the cancer, but trying to preserve the way those structures look and function and maintain a quality of life. And at the same time, we've learned that function can change anywhere along the time spectrum. We've begun to believe and adopt a model of prehabilitation. We don't wait for after the treatment and then start the rehabilitation. We try to start once the diagnosis is made. We empower you with education, exercise protocols, etc. And of course, in this electronic era where everybody is texting and WhatsApping, of course, anybody with a communication disorder has a lot more to work with. So from a speech pathology standpoint, we try to help with facing that onslaught. We help to restore, recreate function, and to give you the tools to educate yourself so that you can be an equal player in restoring your function. We have tools and instruments to chart your progress, to work out and to identify exactly what is going on with function. We have movie x-rays. We can look at through a scope at what's happening with function. We like to navigate between everybody on your healthcare team, your physicians, people in allied health, everybody who's spoken tonight. We welcome active patient participation. We say, bring your team, and we can all work together, and we like that commitment from the time of diagnosis. We also like to offer personalized functional rehabilitation in the center because there's no one formula, one size fits all rehabilitation approach, and we know that for everybody factors are a little different with respect to the big picture, nutrition, body image, etc. So we do try to customize that. Exercise is big in our field at the moment, and we will give you specific kinds of aerobics and exercises for your swallowing muscles, for your jaw. And so, for example, if you've never had to exercise the back wall of your throat to get a good swallow, try biting your tongue or holding a piece of gauze and swallowing at the same time. And you will feel a lot of effort coming from the back there. We talk about stretching your muscles, doing a bulldog like that, leaning back and try and swallow like that again. Put some pressure on this area. There are a whole lot of exercises, for example, and we need to select specifically, but there are specific exercises that we can offer you for all these different structures. For anybody who has a feeding tube, it is absolutely crucial to eat whatever is advised or whatever is safe, and to do swallowing exercises. There is lots of research to show that if you don't use it and if you don't do what you're capable of doing, you will lose it. So there are articles entitled "Use It or Lose It." And again, we like the exercises to begin pre-treatment, and they will probably need to be done for the rest of one's life. Very important to buy in, comply, and get with the program. At the same time, it's not only all about being what happens in that clinical setting. There's lots going on outside this building as well as in it. Take advantage of some excellent self-help books. There are online groups such as Web Whispers for laryngectomies. I've outlined, and there are others. Take advantage of Wellspring, which will put you in the headspace to take on this rehabilitation challenge with all their programs that they offer, whether it's Tai Chi or yoga or exercise, as Leslie mentioned. And we know from our Wellspring laryngectomy group, which we've been running for about 15 years on a monthly basis, and it's attended by social work, speech pathology. We have patients with their significant others. We know that the rehabilitation process continues for many, many years. We have people coming back 20 years after treatment because they feel that they need to update about how to still make improvements, and they know that others will benefit from their experience and they share. And every time I go to a session, I come back having learned something. So take advantage of connecting with people who have roughly similar conditions if you have the opportunity. So I've spoken about how diverse this group is, but let me try and pull this back and give you some generally useful tips. Be realistic about what you expect of yourself. I know that we talk about timelines of recovery at very early on, often before treatment. But it's so often that immediately after treatment, it's a month afterwards, and people are feeling very dejected because they feel that by now they should be able to be swallowing better. Everything should be normal. Whereas they could be expecting at least a year in some cases to make that recovery. And for things to plateau. Don't wait for things to just settle down. Maybe the tissues will settle down, but they don't help. That doesn't help to restore function. Be open and flexible with regards to eating choices and food textures, and do start with wherever you're successful. Purees may sound awful, but healthy smoothies are really hip at the moment, and take advantage of that. They can be extremely healthy. A simple thing like hydration, getting enough water, whether it's through a tube or by mouth, is important because it helps to thin those horrible sticky secretions or the mucus that's in the airway. Keep up the humidity in your environment. We have people who find that their speech is affected when the air is very dry and temperatures are extreme. They just don't get the same contacts, and things feel mushy. So humidity is usually a very good thing in the environment. Do your exercises. It's an investment in your long-term recovery and will give you a sense of control of these structures where you might not have felt that. I mean, even having a simple dental freezing can leave us feeling like, something's really wrong. I don't think I can live like that. Seek help early with lymphedema and scar tissue, because this can evolve and set you up for other problems. Definitely avoid going into hiding, isolation, and withdrawal, because you will throw out your opportunity for support in your home and in your community. It really, getting through this is not nothing, and it takes your team as well as ours. Be an active self-advocate when you come to your appointments. Prepare your questions, make them short and clear, and so you take advantage of the visit as though you're coming to a meeting, you're prepared. It really is the gateway to connect you up, hook you up with any other disciplines where from whom you may benefit. One very simple thing is if you have horrible secretions, sticky mouth and sticky saliva, try to rinse out and gargle before you eat as well as afterwards, because otherwise you've got stuff sitting there and you've got a virtual oral obstacle course, which just makes things sticky and so much more difficult when it comes to swallowing. And talk to other people about their dry mouth solution. Certainly, there are products that are available, But we've had patients teach us that things like hemp oil and flaxseed oil, when used to coat the lining of the mouth, give a far more prolonged feeling of moisture in the mouth, and that may work for you too. Lastly, stay in touch as needed. Things can change at any point along the way, and if you have a question, if you feel this needs to be addressed, don't hesitate. So I'm going to leave you with Salvador Dali again and his famous lips couch, and hope that you will feel inspired after this evening to take the reins, take charge, and move forward with your rehabilitation. Thanks for listening, and again, look forward to questions.
Thank you.